58,000 people died of the flu last year or of some type of complication related to getting the flu, like pneumonia.
Winter is right around the corner. So is the 2023 flu season, which means now is the time to consider getting vaccinated.
Last year, our flu season peaked a little earlier. In South America this year, in the Southern Hemisphere, it peaked a little earlier. So there is potential this year for it to peak earlier as well.
That said, there are misconceptions, fears, and questions that go along with vaccinations. So Dr. Lea Monday, an infectious disease specialist at Detroit Medical Center and Wayne State University, is helping to clarify a few things. Starting with, how effective has the 2023 flu shot been thus far?
The recent data that came out of South America showed it reduced hospitalizations by 52%. So this is very encouraging that as we move into flu season with the same vaccine in the Northern Hemisphere, we hope to see the same efficacy in our patients as well.
Secondly, when's the ideal time to get the flu shot, and who should get it?
Ideally, we want everybody vaccinated by the end of October. So by Halloween, if you want to think of something simple. And that is because really we want people to reach full immunity by the time we hit peak season, which in general in the US is between December and February. Immunocompromised patients with heart disease and lung disease or cancer, pregnant women as well, who, although they're healthy, are very prone to severe disease with respiratory viruses, and kids. Especially kids who are under 8 who haven't been vaccinated before.
For those moms-to-be, Dr. Monday says it's important to remember unborn babies can only be protected by their carriers, and they aren't eligible for the flu shot until they're 6 months old. So protecting you protects them. As for kids,
a child who's never been vaccinated before, they might have to think about it earlier rather than later because they have to get 2 shots in before the immunity can really set effect. Kids who are already 9 years old or older just need 1 vaccine.
How about this one? Is the flu shot itself a live virus?
The flu vaccine contains no live virus.
All right, arguably one of the biggest questions out there, are the COVID booster and flu vaccine compatible?
The flu shot and the COVID shot can be administered together at the same time in the same visit. You actually can get them in the same arm if you want, 1 inch apart, or what a lot of people prefer is 1 in each arm. Either way is fine.
As for cost, you're in luck.
The flu vaccine should be covered by everybody's insurance payer or by the federal government. You can sign up for a vaccine in a local pharmacy and get them for free.
And some good news for those of you with egg allergies. New guidance has been released stating that those with egg allergies can now get any vaccine without special monitoring or special guidance. For those details, refer to the CDC. Liz Lewin, Fox 2 News.